if you look at the whole lifespan of schizophrenics, and by the way, they lose about, on the average, 20 years of life.
Oh, wow.
So if it's 80 for the typical person, it's 60 for a schizophrenic, and then say between 30 and 60, the largest percentage are going to be in your community mental health centers all over the country.
Got it. This is super helpful. And then as we think about how prescribers are split up within these settings for major depressive disorder, how are prescribers split up in terms of like number of healthcare professionals within each of these sites of care?
Your question is, what's the relative percentage of providers within, say, that in each of these settings? Yeah. Well, okay. In a community mental health center, and I tell you about the big ones in Nashville, they basically provided it for the whole city, and major. Each of them would have a flagship place and then satellite clinics all over the city. The top of the hierarchy are physicians who represent, I would say, at most 20% of the prescribers, maybe a little higher, 30%, and then the rest of the prescribers would be these nurse practitioners. If it's a state that's going to have psychologists with privileges, then you'd find that would be cutting into both of those two previous groups, depending on how good they are, and but they cost somewhere between the nurse practitioner and the psychiatrist, and so they'll get their share if they can do the job. Surrounding them are nurses and many so-called caseworkers who are master's levels or sometimes just straight out of college, who've had some training. Much of what they do, I mean, it's like social work really, and they get to be skilled in helping patients navigate housing, insurance issues, legal issues that come up, getting them to medical clinics to get their medical care. And there's a large number of those. They will have caseloads of 100, 200 patients, maybe smaller, depends on the thing. The doctors can have caseloads of 300 to 500 patients, the same thing. And you say, how could they do that? Because they're seen once a month, and they're seen for 15 minutes at a time. And the caseworkers and support staff at the clinics keep them moving rapidly through the thing. So you can see there's very little time for talking with the patients, and that's what the case managers and group therapy gets set up for these things. So I don't want to leave you with the impression it's total chaos, but you have to have, if you're a patient in a family, you have to be pretty lucky to get into a setting that's really working as it should be to provide team care, to get to meet the needs of these very needy people. In some ways, it's easier to treat the group that it's the most difficult to treat, and everything I've just said is probably the bipolars for the reason of the noncompliance and the recurrence, the rapidity with which the manic, hypomanic states come back, and frequency. A person with schizophrenia who's on a medication that's really working for them can be very stable for years on end. Doesn't mean they're well, but they're not actively causing mischief for themselves or others.